I'm Lisa Greenwald, CEO of Greenwald Research, joined today by my esteemed colleague and Greenwald's founder, Matthew Greenwald. We're going to be sharing a little bit from two surveys about consumer concerns about Social Security, but perhaps even more importantly, how Americans want to see Social Security reformed or fixed. If you haven't tuned into one of Greenwald's coffee breaks before, they are small, informal, and short discussions on research we're conducting and topics that we think are going to be interesting to our clients and our friends. We strongly encourage you to chime in. You are welcome to pop onto audio or video to share a thought or a question. Or you can do chat. I'll be keeping an eye on that as well. So we certainly like it when this is more of a discussion. So without further ado, please grab your coffee or your tea or your water, and we are going to dive in. I can get my slides going. All right, the first bit of information I'm going to be sharing with you is from the 2025 Retirement Confidence Survey, which Greenwald conducts every year with EBRI, Employee Benefit Research Institute. It feels a little strange to start without confidence as the major metric here. So just to table set, RCS found this year 67% of our workers very or somewhat confident that they will be able to have enough money to live comfortably throughout retirement. That was unchanged from the prior year. 78% of our retirees very or somewhat confident overall that they'll have enough money to live comfortably throughout retirement. That was up, actually, from last year when it was 74%. But I'm going to jump right in with the concerns because there are many. And one really stands out for me here, right? While workers put increasing cost of living as their number one concern at 81%, a really close second at 79% say they are very or somewhat concerned about the US government making significant changes to the American retirement system. And that is the number one concern for our retirees. Now, interestingly enough, you can see our retirees got a little less very concerned about several of these things, which might explain this bump we saw in overall satisfaction. But we didn't see that same change when it comes to concerns about changes to the American retirement system. So we asked this year, what changes are you concerned about? 3 of the top 4 issues involve Social Security. At the top there, 6 in 10 workers, 8 in 10 retirees concerned about a reduction in Social Security retirement benefits. Half are worried about an increase in the age in which they would be eligible for Social Security or for Medicare. And 4 in 10 are concerned about increased taxes for Social Security. Now, here we're talking about Social Security, but I'd be remiss not to mention that a reduction in Medicare benefits, significant concern for about 8 in 10 retirees as well. So how are our workers feeling about Social Security? So-so. It's about 50-50 who feel very or somewhat confident and those that don't, but only 16% feel very confident. So interestingly enough, there's very little difference in age groups on this finding, right? Different age groups within the worker category tend to answer differently. Men tend to be more confident that Social Security will continue to provide benefits of at least equal value to what they receive today, more so than women. And there's a really strong connection between overall retirement confidence and confidence in Social Security, right? Those more confident overall are more confident in Social Security. Our retirees are a little bit more confident than our workers, at 2/3 feeling very or somewhat confident that Social Security will continue to provide benefits of at least equal value to what they receive today, but only 13% very confident in that. Here we do see an age difference. Retirees under age 65 are a lot more likely to say they are not confident in Social Security. And those 65 plus, of course, more confident. And confidence aside, workers are still expecting, 9 in 10 workers are still expecting income from Social Security to be either a major or a minor source of income for them in retirement. Although notable, the biggest number here, that 51%, is minor source. That is very different than what we see with retirees. For retirees, 66% say Social Security is a major source. Only 28% say it's a minor source. But again, overwhelming numbers expecting or currently relying upon Social Security. That 66% is up slightly from last year, but not wildly so. We were there in 2023, right? Not a major change or trend difference. Given the importance of Social Security, workers expecting it, retirees relying upon it, you'd think we'd do some better planning. This question we asked to prepare for retirement. Have you or did you do either of these things? Thought about how the age at which you claim will impact your benefit amount, or just simply reviewed your benefit amount if at your planned retirement age. 8 in 10 retirees rather, say that they did this in preparation for retirement. That's up from last year. We certainly hope it continues to go up. However, it's only about half, maybe pushing 6 in 10 of our workers who have done these things. But not all is lost. If you look at the worker data by age, there is a dramatic and important difference. So our 25 to 34-year-olds, only about a third of them have done these 2 steps to prepare for retirement. At 35 to 54, it's about half. And at 55 plus, we're really starting to hit 3/4 or more of our workers. So our workers are doing this just maybe a little later in life than we want them to. And that 45 to 54 age group, we probably don't want them at half, right? Like we probably need to move up in the timeline when people are starting to review and think about Social Security claiming. We also asked how well workers and retirees understand the impact of when they claim on their ultimate benefits. 7 in 10 workers say they understand it somewhat well. 8 in 10 retirees say they understand it somewhat well. I always tend to trust that top box more than anything, right? So just 22% of our workers say they understand it very well. Only 26% of our retirees say they understand it very well. So when do workers think they're going to claim? When do retirees report that they claimed? The median age here is 65, and that hasn't changed in many years. But there's some moderately good news happening in that 66 to 69 category, where now 1/4 of our workers expect to claim somewhere in that 66 to 69 range. And nearly 1/4 of our retirees report that they did, both up from last year. So this is sort of table setting for what Matt's going to share with you. He did work for a great set of organizations on how to reform Social Security, which so many clearly rely upon. Matt, take it away.
Thank you very much, and good morning. Thanks for attending this coffee break. The Social Security Trust Fund is expected by Social Security actuaries who are good at this to be depleted within 10 years. And if that happens and nothing is done, Social Security benefits will be cut by 20%. And this uncertainty about what's going to happen creates a real retirement planning problem, because if your goal is to supplement Social Security with the money from the assets you acquire by retirement, how much can you count on Social Security producing? We did research using a powerful statistical technique that has not been used, as far as I know, for other public policy issues, to provide new and I think useful insights into what Americans prefer. And just to steal a little thunder, the results are encouraging, because though it's impossible to know how political issues are resolved, at least I think we have a sense that there's a high consensus among the public about how to address this problem. Okay, what did we do? We did the work for the National Academy of Social Insurance. The report is on their website. We surveyed 2,243 Americans, 21 and above. The work was done in the summer of 2024. We used conjoint analysis to understand preferences. More on that later. We used NORC's AmeriSpeak panel, a high-quality online panel. We allowed people who prefer Spanish to answer the questions in Spanish, and we did a pretty thorough job in weighting the data to reflect the U.S. population, a margin of error plus or minus 2.1%. Okay, next chart. So importantly, and this is to supplement, at least all already laid out, that Social Security is expected to be a major source of income. How important is it to people's monthly income? Among the people who are now receiving Social Security benefits and really know, 83% said it's very important to them. 1% said not too important. 1% said not important at all. Pretty important. Among those not receiving benefits now, who historically underestimate its importance to them, still 52% say these benefits will be very important to them. 10% say not too important, and only 4% said not important at all. Next. So what would happen if you couldn't get Social Security benefits? We gave people 4 choices, and shockingly, in some ways, 36% said without Social Security in retirement, they would not be able to afford the basics, such as even food, clothing, or housing. Another 30% said they would have to make significant sacrifices, but at least they could afford the basics. That's 2/3 in one of those 2 categories. 27% said their budget would be tighter, but they would get by. And 7%, only 7% said it would have no impact. And then when we looked at the people whose household income is above 200,000, even those upper income people, only 18% of them said Social Security would have no impact and no effect. Next chart. And one of the key issues is, although it could be solved in other ways, benefit reductions with increasing taxes or no increase in taxes and benefit reductions. Gave people 3 choices. And here I'm showing it by political party because I think in some ways that's salient. And you'll see a little letter to the right of the number, which indicates statistically significant. So among 3 choices, 55% overall said we should ensure Social Security benefits are not reduced, even if it means raising taxes on some or all Americans. Democrats are more likely than Republicans to say that, but even 52% of Republicans pick that choice. Secondly, some people, 30% overall, say we should increase Social Security benefits, even if it means raising taxes on some or all Americans. Republicans are least likely to pick that option. And the third choice is we shouldn't raise taxes on any American, even if it means reducing Social Security benefits. 15% overall choose that. More 24% Republicans, they're most likely, but still only 24% of Republicans. So overall, 85% said we should ensure benefits are not reduced, even if it means raising taxes. Only 15% don't want to raise taxes. And there's broad preference for raising revenues and instead of reducing benefits. It's preferred by raising taxes rather than reducing benefits is preferred by over 3 in 4 Republicans, over 9 in 10 Democrats, over 8 in 10 independents. So,
Hey, Matt.
next slide, please.
Hey,
Nevin?
Matt. What are
Yeah.
the little R's and
I'm
TDIs?
sorry, yeah. Let me emphasize that. If something was statistically significant, we indicated it by a letter. So if we go up to the 59% who would prefer to ensure benefits not reduced, we see the Democrats in the violet, purple, lavender are more because of the R, statistically more likely than Republicans to adhere to that view. On the other hand, if we look at the bottom one, we see that Republicans, 24%, is statistically higher than independents, in Democrats, and the total. Is that clear?
Yeah, that is. Thank you.
Of course. Thanks for raising the question and making sure it was communicated properly. Next. So we know what people want, but what specifically do they want? How do they want to address this problem? Because just say raising taxes is not specific enough. There are a lot of choices. To try to get insight into that, we used a conjoint analysis, sometimes known as trade-off analysis. Conjoint analysis has been around for over 50 years. It's based on some pretty high-level math, Bayesian math, and the work of some mathematical psychologists and econometricians. And soon after it was developed, it was said conjoint analysis quickly became the most broadly used and powerful survey-based technique for measuring and predicting consumer preference. It is startling in some ways. It's been so powerful and used so much over 50 years, it's not being used on public policy issues, but we did. Conjoint analysis measures preferences and the strength of preferences by having survey respondents make a series of carefully designed choices. And its benefit is that in some cases, like Social Security, there's many features and many permutations. Let's say 1,000 permutations. We tested something with over 1,000 permutations. You can't ask people 1,000 different permutations. Conjoint analysis allows you to ask a reasonable number of questions, let's say 10 to 12, and estimate which of the 1,000 they prefer the most, and also which feature in the overall package drove preferences higher or lower. Let me just give you an example. If I wanted to find out what you preferred for lunch, I could ask you, would you prefer a hot dog, fries, salad, and cherry pie for $15, or a hamburger, fries, salad, and cherry pie for $15? Not that hard to know if you prefer a hamburger or a hot dog. If I would know how much that hamburger is worth to you, I could then ask you, do you prefer a hot dog, fries, salad, and cherry pie for $15, or a hamburger, fries, salad, and cherry pie for $22? And it's by asking well-designed preference choices that we were able to discern the one package that people prefer the most. And in each case, with each package we presented, we inform people based on analyses from Social Security Administration what impact that choice would have on the financing gap. No choice means the financing gap is 20% and benefits reduced by 10%. Some choices could increase the financing gap, others could decrease it or eliminate it. So next. For this test, this is what we considered. Changing taxable earnings cap, which was 168,000 then, 2024, now I think it's 176,000, with different options, raising it, having a donut hole, raising it different amounts, 6 options. The tax rate, raising it from 6.2, where it is now for employer and the same for employee, to 7.2 or 8.2. Changing the age of qualification for full benefits, now 67 to 68 or 69. Changing the COLA by increasing the adjustment or decreasing the adjustment, giving work credit for parents who are caregivers of children under 6. That's been proposed by some member of Congress. Increasing benefits for all beneficiaries, giving everyone an extra $250. won't steal the thunder, but say people like $250, but with every choice, we told them the impact on the financing gap, and that would increase the financing gap, and people didn't like that. Benefits, Social Security benefits are now taxed. Gave them two options: eliminate the tax or eliminate for high earners. Giving a bridge benefit to people who have a history of physically hard work by, if they retire before 67, giving them less of a cutback in their benefits, and reducing benefits for some higher income people. In addition to these choices, we also gave the option of no change at all. And importantly, next, this is what we found. There we go. This package is preferred by 82% to the current program, and of all the different permutations, it was preferred the most. And and also, I should say, this closes the financing gap completely. In fact, adds 1% to the surplus. This is an order of importance. The most important feature, the one that drove the most preference, was keeping the current cap then at 168,000, and also start collecting Social Security taxes on earnings above 400,000. And not giving additional benefits on the income tax on earnings above 400,000. There was no choice where we'd give them additional benefits. This is what people like the most. Second, increasing the tax rate from 6.2 to 7.2, not 8.2, 6.2 to 7.2. Not changing the age of entitlement for full benefits from 67, increasing the cost of living adjustment based on inflation for older people. Now, I said that people don't like increasing the financing gap. This increased the financing gap, but it was still preferred. Giving parents who are caregivers for children under age 6 credits for work when calculating benefits, even though they increase the financing gap. Not giving everyone $250. That's something that people didn't think was worth increasing the financing gap for it. Giving a bridge benefit for people with a history of doing physically demanding work. And this is made the least impact, but there's a slight leaning towards reducing benefits for high earners. Beneficiaries with the 60,000 of single, 120,000, if not in non-Social Security income, reduced benefits. So this is a solution that people want by an overwhelming part. It eliminates the financing gap, and it has some target increases. And I think importantly, it's really supported very broadly by different segments, by education, household income, party affiliation, and age. And if I could just say one more thing, on the last chart. Sorry. Yeah, here we go. I said we could see which impacts preference the most. Applying a payroll tax on earnings above 400,000 has a powerful positive impact on preference. Keep increasing the tax rate to 7.2 because they raise revenues, which people want. But people raising the age of entitlement for full benefits also reduces the financing gap, but people didn't want it. What drove down preference was not changing the tax gap, because that gave forego a chance to decrease the financing gap, decreasing the cost of living adjustment, increasing benefits by $250 a month, and increasing the full retirement age by 67 to 69. Those are features which drove down preference. And with that, I stop and thank you, and ask if there are any questions or comments.
That is your Friday morning rundown on Social Security findings from RCS and NASSI's Social Security at 90 study. Anything surprise anyone?
You put the chart back up?
Which one you want to see, Nevin? The overall preferred?
The one before that one. Yeah, this.
Okay.
Okay. I'm going like halfway down the list, and this may just be me being naive, but I'm sitting there thinking parents who are caregivers for children under age 6, I assume that would be like their grandchildren.
No, it would be parents who are raising a child under 6 and not working,
Stay at home. Yeah.
Stay at home mom or dad.
So
And
they're,
when you earn
so this,
money, you get a tax credit for the work, which goes in computing your Social Security benefit. Right now, they're credited with no earnings. This would credit them with some earnings.
oh, okay.
Okay,
I get
sorry.
it now.
I went a little too fast. Sorry about that.
No,
So,
no, no. I was thinking this was retarees with children under
no,
six. I
no,
was trying to figure out how that happened.
no, this is for people working who, raising a child and would get reduced Social Security benefits would give them a chance to get a little more at the end. Again, it's
Right.
noteworthy that the driving factor is a desire not to decrease benefits. I think that's clear. This shows how to do it, and what drove it was telling them the impact on the financing gap. That's one of the great things about conjoint analysis. We don't ask people if you like or dislike something, because if we ask them, and we did, we want to get an extra $250, people say yes. But this allows them to see what impact out in the financing gap, which is a driving force. So basically, even though people don't want to increase the financing gap, they're willing to, on a few occasions, don't increase the COLA, give parents of raising kids on 6 work credit, and giving extra money to allowing people who retire from physically hard labor a chance to have a reduction. So I think that's kind of interesting. But again, the driving factor is the desire to bring more revenues in. And the most easy way is, it's easy for people making under 168,000 to say, yeah, tax those people who are making under 399,000. Yeah, let's tax the people who are making 400,000. So that's not surprising, and that's the driver. So anyway, as I said, we have to make decisions if they're working about how much to save for retirement. If you don't know what Social Security will bring in, it might go down by 20%. This says it's likely not to go down by 20% at the least. Other comment or question?
Matt, it's Kelly. Thank you for sharing this. How do we get at 400,000? Were there different thresholds that you tested? And did people who are making 400,000 and more, did they say tax me more?
We chose each of these options because they have been proposed by a member of Congress. And because of that, Social Security did analysis of impact on the financing gap. We needed the financing gap, so we were stuck with things that have been proposed. I don't know how the politician came up with 400,000. Didn't look at 400,000 plus because it's pretty small. But people who were making 200,000 above were supportive of this, surprisingly. Because with inflation, they're going to get there. So so there's very broad support for this, even among very affluent people.
I think the 400,000 is the thing certainly that President Biden hauled out as saying nobody who made more, under 400,000, they wouldn't see an increase in taxes. That's where I went. I don't know whether he came up with it or he borrowed it from somebody else.
Some member of Congress, I don't remember at this point, but I could find out who proposed it. But this was, I guess they thought politically safe.
I find it interesting. There's so much support for not increasing the benefits age, because that's long been held out. I think there's been some doubt cast on the realities of doing that, but there's so much press about how we're all living longer and longevity and all that kind of stuff, and so and of course that was one of the big fixes in 1983, was to gradually increase the retirement age. I think it's interesting that there's so much support for not changing that now, because I would have expected sort of more of a reality to kick in, but maybe COVID has shifted people's perspectives on things like that. I don't know.
It's easy to justify raising it. It's not what people want, but they didn't object strongly to raising it to 68. They objected strongly to raising it to 69. So I think that's also interesting. Not that much opposition to 68, a lot of opposition to 69. Although in 83 it was raised 2 years over a period of time.
Yeah, but they took forever to do it. So I think at the time they did it, people like myself who were affected by that sort of shrugged it off. And again, the great benefit to doing things like that is that politically you can get it into the system because the people who are at that brink aren't affected. So they shrug it off. But I don't know, I don't think our funding situation is as desperate today as it was in '83. But again, I was looking at life a little differently in 1983 than I am now.
By the way, this idea of phasing in increased revenues, such as getting increased revenues by raising the age for full entitlements over a period of 20 years or so, it's not unlikely that Congress is going to wait a long time to make changes, and when 2034 comes around, they won't be as impacted on terms of the health of Social Security, that it would cut out the benefit, the financing gap completely. So ask people, what would they like to have happen if in 2034 there was enough resources beyond Social Security taxes to pay benefits, and benefits would have to therefore be cut? There was favor by about 2/3 of bringing in federal general revenues. So, that's sort of been sacrosanct, keeping Social Security as a confined system. But if it can pay benefits when the trust fund is depleted, there's favor of using general revenues for that purpose.
Like we haven't gotten used to spending money we don't have.
I hear irony when I see it.
This is very interesting, guys. Thank you.
Andy?
No, I just turned my audio. I didn't have a specific question. I appreciate the information. It's a good summary and useful for everybody to keep in mind. I will just add that I was struck by the fact that so many people were interested in doing the general revenue thing. We've kicked around that idea for years for using different justifications, and but I think it rarely gets tested. So I'm glad you guys did that part where you actually ask people that question, because I think it's rare to get any information from public opinion polling on that.
I think people don't understand the differences. I think that's the beauty of the trade-off analysis y'all are doing, is it allows you to sort of get past the sort of the binary, the kind of question you normally get, which is more binary. And if people don't really understand how, so I mean, everybody still thinks that the money that's been taken out of their paychecks over the years is sitting in an account with their name on it. So anyway.
Well, we are happy to stay on. I'm going to do our official close and thank you all for joining us. Greenwald conducts these coffee breaks every month, and we hope to see you again. You can also view recordings of this and our past coffee breaks on our website. And lastly, this year, Greenwald is celebrating its 40th anniversary. So in addition to our monthly coffee breaks, we're going to be doing more formal webinars with experts throughout the year. And our celebrations will culminate in an in-person event, November 4th and 5th in Washington, D.C., our first ever Health and Wealth Symposium. And we hope that you will save the date and join us for that as well. Thank you all so much for your time today.